Hello everyone. Today we are going to discuss about the high risk newborn, that is low birth weight. The first with introduction. The low birth weight is a term used to describe babies who are born weighing less than 5 pounds or 8 ounces or in grams 2500 grams or 2.5 kg. So we have studied that who will come under the low birth if the baby weight is less than 2.5 kg. An average newborn usually weight about 8 pounds. Okay, see in the pounds also I have given, in the ounce also, and in grams and kgs also. So a low birth weight baby may be healthy even though he or she is small, but a low birth weight baby can also have many serious health problems. So what happen, like if the baby is not low birth, it doesn't mean that baby is unhealthy. Sometimes even the low birth weight baby also healthy, but the low birth baby will have more serious health issues. Some low birth weight babies are healthy, but others have serious problem that needed to be treated. Premature birth, like before 37 week of gestation or pregnancy, and the fetal growth restriction are the most common cause of low birth weight. And a baby with low birth weight may have trouble eating, gaining weight, and fighting off infection. Means if the baby is born below 2.5 kg, okay, they'll have a difficulty in gaining weight and they'll have less immunity power, so they can't fight against the infection. Low birth weight and the very low birth weight infants are particularly susceptible to infection because their immunologically is deficient. Means normally we know already babies, they have less immunity power compared to adult because their immunity power is growing. But in case of low birth weight, they have more deficiency of immunological system, okay, or immunity power. Next is definition of low birth weight. According to the Payodata, low birth weight is a term used to describe babies who are born weighing less than 5 pounds or 8 ounces or 2500 grams. An average newborn usually weighs about 8 pounds. A low birth weight baby may be healthy even though he or she is small, but a low birth weight baby can also have many serious health issues. And according to Javed Ansari, infant low birth weight happens when baby weight less than 5 pound or 8 ounce at birth. Low birth weight often occurs in baby who are born prematurely before 37 week of gestation, and it's also common in multiple birth situations such as twins or triplets. Why means in that case they'll have less space in the womb to grow. So if case of twins or triples, there is a more chance of having low birth weight baby. Next is incidence of low birth weight. Neonatal mortality is defined as the death during the first 28 days of life, and India reports the highest number of neonatal death in the world. As many as 70,000 newborn are die in India each year, 29 per thousand birth. Okay, so like compared to other country, India is having more rate of this low birth weight baby and neonatal death. Okay, in 2013, nearly 22 million newborns, and estimated 16% of all babies born globally that year had low birth weight. So in 2013, they have done a survey in that they have found that like 60% of the babies born with low birth weight. The next one is type of low birth weight. The low birth weight are classified into three major types: malnourished, hypoplastic, and mixed type babies. So now we are going to see one by one. First one is malnourished. Apart from prematurity, intrauterine growth retardation may also result in low birth weight, and this growth retardation has two strong predictors. One is maternal infection, one is no nutrients consumption. And infection not only reduce the appetite and dietary intake but affect maternal absorption of nutrients as well as, and there are maybe metabolic stress or resulting in higher requirements of nutrients. Second one is hypoplastic babies. A hypoplastic uterus is a uterus that is very small in size from birth. And hypoplastic uterus is the result of incomplete development of the uterus during the birth. And these babies are small in all parameters including the head size, and the cell number is reduced, postnatal physical and mental growth is poor, and risk of occurring congenital malformation is high. So this is the defect that the mother is having from birth itself. So in that case also there is a chance of having low birth weight baby. Next one is mixed. So mixed of both. These babies have above both the type of physical characteristics and mental characteristics. Okay. In these babies there is a reduction in the cell number and in the cell size both. So in the one we have seen in the malnourished, the baby will have deficiency of this nourishment, and in the hypoplastic we have seen that the uterus size is small, so baby will not have the sufficient growth. So in the mixed there will be deficiency in the both in the physical as well as in the mental. Next we are going to see that causes of low birth weight. The first one is maternal history. So it comes if the mother is having any maternal history, like during the pregnancy or during the childbirth or in the postpartum period. Okay, it can affect the baby size. Okay, so it encompasses the healthcare dimension of family planning, preconception, prenatal and postnatal care in order to ensure a positive and fulfilling experience in most cases and reduce the maternal morbidity and mortality rate in other cases. So in the mother, if during the pregnancy or during the delivery, if the mother is having any condition which can affect the baby's health, like I have told you, like preconception planning, family planning. Okay, next one is maternal malnutrition. Means, as you know, during the pregnancy the mother should have a good nutritious food. Okay, because she have to eat more for the babies and for her, because the requirements is more. So if the maternal have malnutrition, means they don't have sufficient nutrition in their body, it increases the risk of poor pregnancy outcome, including the obstructed labor, premature or low birth weight babies, and the postpartum hemorrhage. Severe anemia during pregnancy is linked to the increased mortality at the labor. The low birth weight is significant contributor to infant mortality. The next one is intrauterine infection. This means when the baby is in the womb, in that time if the mother is having any infection in the uterus, it can affect the baby and baby become low birth weight. The next cause is placental dysfunction. Everyone knows that what is the normal function of placenta. The placenta will supply all the nutritions, all oxygen, everything to the blood supply to the baby. If placenta is having the dysfunction, like insufficiency in the placenta, okay, means placenta is not having sufficient place for the growth. Okay, you can see the picture. Normally what happen, placenta should be in this area, but wall of the womb is different and there is a gap between the womb, wall of the womb and in the placenta. That is abruptio placenta has come away from the wall of the womb. Placenta is separated from the wall of the womb, so it can cause affect the baby's weight. The next one is twin pregnancy. See the picture. In case of twin pregnancy, what happen after 35 weeks of gestation, mother is not capable to provide the adequate nourishment to more than one fetus. Means they don't have sufficient space to grow, and mother also is not capable of providing that much nutrients to both the babies. Next one is maternal disease. So maternal illness like birth defect or prevention for expecting parents. Maternal illness increase the chances that your baby will be born with the birth defect or have a chronic health problem like diabetes, cytomegalovirus, toxoplasmosis, okay, staphylococcus B, like any other infection that mother have, it can affect the baby also. Next one is genetic disorder, or you can say hereditary disorder. A woman is considered at high risk because of the screening test. A woman is considered at high risk because she has previously had a pregnancy affected by a genetic or chromosomal disorder like Down syndrome. Okay, an ultrasound examination has detect features or abnormalities indicating an increase the risk of the chromosome abnormality. So when the baby is in the mother womb, they will do a congenital anomaly test. So in that they can find out that if the baby is having any genetic disorder. Next is clinical features or signs and symptoms of low birth weight. First one is low oxygen level at birth. So if the baby is low birth weight, they will have low oxygen level during or at birth. Next one is inability to maintain the body temperature. Okay, so compared to the full term baby, they will have they are not capable to maintain the temperature to the extrauterine environment. Next one is difficulty feeding and gaining weight. So if the baby is having less weight, they will have difficulty in feeding and they will have difficulty in gaining weight. Next one is infection, because their immunity power is low, so they have more susceptibility to get infection. Weight less than 2.5 kg or 2500 gram. Head are large. Okay, compared to body, the head will be large. Okay, or there is a chance of having any other congenital anomalies. Next one is evaluation or diagnostic evaluation, that is first one is history collection. So in the history collection, what we are going to ask, we are going to ask all the maternal history, like mother is suffering from any illness like diabetes, hypertension, or mother she has any previous pregnancy with congenital defect or low birth weight. Okay, or in their family they have any genetic disorder. Everything we are going to ask in the history collection. Ultrasonography, it is a very common things and very easy method to find out. Ultrasound is a more accurate method of estimating the fetal size. Measurement can be taken of the fetus head and abdomen and compare with a growth chart and estimated the fetal weight. So during the scan, they can measure the head size and abdomen size, and they can find out the according to this week how much weight should be there. Blood test to find out any abnormalities, any chromosomal defect, okay, any deficiency. Then arterial blood glass analysis. Next is management of the baby. Okay, medical management, pharmacological management, and nursing management. The first one is monitoring the vital signs is very important. We have seen that baby is having difficulty in adjusting with the temperature. Okay, baby will have less oxygen levels. The first management will come monitoring the vital signs. Next is monitoring the arterial blood glass analysis and electrolytes, okay, like sodium, potassium, calcium, magnesium, and chloride. Then tolerance of feeding you have to observe, because they'll have difficulty in feeding also, and they'll have difficulty in digestion also. Then provide in uterus malleus. Next one is avoid excessive light, sound, and painful procedure who is having newborn or low birth weight baby. Then phototherapy if the baby is suffering from jaundice. Then kangaroo mother care. Next is pharmacological management, that is tablet folic acid 400 mg, tablet vitamin D 250 to 500 mg, and tablet zinc 150 mg. Nursing care plan, risk for infection related to the loss of skin impairment, immune response, and invasive rapies. Risk for impairment, growth and development related to the premature birth. Deficient fluid volume related to poor nutrition or intake water. Next is complication of low birth weight. First one is increase the risk of infection. Next one is sudden infant death syndrome. Sudden infant death syndrome, also known as cot death or crib death, is a sudden unexplained death of the child less than 1 year of age. Breathing problem and immature lung, infant respiratory distress syndrome, okay, because baby's lung mature in the later stage of pregnancy. Baby born extremely and moderately premature may have immature lung that lead to be breathing problem, and indrawing or powerful sucking in of the chest with each breath, exposing to the ribs beneath the skin. Development delay means compared to their age, how they should be developed or how they should have a growth, that will be not there, both physically as well as mentally. Next, health education we have to give to the parents and the family. With this we have completed this low birth weight baby. Thank you everyone.